Hello everybody, I'm Dr. Jay Burness, and I run a concussion-focused functional neurology and chiropractic practice in Oakville, Ontario. And I got an email a couple of days ago from Rebecca, and she's asking a specific question here, I think here, that might be helpful for everybody to hear. So Rebecca asks, "Hi Dr. Jay, I hit my head in July and have suffered with dizziness, headaches, and a stiff sore neck ever since. My doctor says my problems are all coming from my neck. So I've been doing physio and massage for the past 2 months trying to fix it. My neck feels better after the massage, but it just stiffens up again over the next couple of days. I feel like I'm not getting anywhere and wondering if I should continue. What are your thoughts?" Thank you for your time, Rebecca. So Rebecca, I can't tell you not to do a treatment that's been recommended by another doctor, but I will give you my opinion or my experience with these types of things. And you know, there's a few things here, but whenever anybody tells me that they're dizzy and they have a stiff neck, you know, I don't go to the neck is causing the dizziness. I go to the dizziness is causing the neck issues. And let me just try and explain that for you. So when you've injured your vestibular system, the balance system of the brain, it can throw off the eyes, and I think I've shown that in some other videos. Say, for example, you have a right-sided injury in the vestibular system and you're weak on that side. So what tends to happen, you know, the vestibular system is push-pull. You have a left side and a right side, and they have to be equal strength and activity for you to feel stable. And what tends to happen is if you have an injury on one side and it's weaker, the vestibular system signals from the strong side will push the other side of the weak side away, and in terms of the eyes anyway, that will make the eyes want to wander towards the right side or the weak side, and then they'll beat back. And that's a vestibular ocular reflex, and I think a lot of people who've had concussions or people who are watching these videos probably know what that reflex is. And that is just that the wiring from your vestibular system to your eyes, they're connected. So if you turn your head to the right, your eyes go to the left. If you turn your head to the left, your eyes go to the right. And that's a reflex activity. You don't have to think about that. It just happens. So when we see this problem, when we see dizziness, quite often you will see that wandering of the eye. Sometimes you don't see it as the patient is looking at something. You might see it when their eyes are in the dark and they can't really focus on something. But anyway, it's a reflex. And there's also this another reflex that your vestibular system uses, the vestibulospinal reflex, where if you move to one side or if your weight shifts to one side, you're going to bend your head in the opposite direction to try and keep your eyes level, or to keep your weight bearing level and under control. So and quite often when we have a movement of the eyes, say the eyes are wandering to the right, again, that normally happens when we turn our head to the left. So guess what? Your vestibular system, if your eyes are going to the right, it's gonna want to turn your head to the left. So you're gonna have this constant activity where the muscles are tightening, trying to turn your head. And it's not gonna manifest with your head moving because you're aware of your head and you won't allow it to move, but the muscles will still signal. They'll signal and contract. So that repetitive motion, basically, usually it's opposite the direction of the eye movements. If the eyes are going up, then the head tends to want to do this, go downward. Anyway, so the repeated activity there can drive stiffness in the neck muscles. And you can massage that neck till the cows come home, but it's not going to change anything because the signal is still there. The imbalance is still there that wants to move those muscles of the neck, wants to move the head. So that can be frustrating to try and deal with the muscles when the real problem is in the vestibular system. Now that's not always the case. Certainly there is cervicogenic dizziness, cervicogenic vertigo does exist, but it's pretty rare. Most of the time in my patient population anyway, it's the other way around. So I don't chase the neck, we chase the vestibular system and get that stabilized so there's less of these ocular movements happening, there's less signals from the vestibular system causing aberrant movements or activity in the muscles of the neck. And for most people that makes a big difference. And I don't generally see the patients who are having cervicogenic vertigo. It's coming just from their neck because they get their neck addressed in, just like Rebecca's doing here, in physio or massage therapy, and it solves the problem. But I tend to see the ones that don't get better when they do that because, again, rightfully so, if a person has headaches and dizziness, and their neck is bothering them, absolutely. Most doctors, chiros, physios, massage therapists are going to at least try and fix the neck and see if it makes a difference. So that's my opinion on this thing. And the other thing that comes up here is she's been doing the massage for 2 months. And, my rule with any treatment for these types of issues is, you give it a good solid effort for a month. I might work with a patient 12 times in the course of a month. And you better be seeing some improvement to justify going any further beyond that in terms of treatment. If I'm not getting any improvement in somebody after that number of sessions, I'm just going to say, hey, try something else. I'm not helping you. Okay, so hopefully that's helpful for you, Rebecca, and anybody else who's watching. And I guess I'll see you next time.